What is bloating? Intestinal gas is a topic that people often find difficult to discuss, but we all have gas in our intestinal tract. Gas can contribute to a sense of bloating, fullness, belching, abdominal cramps, and flatulence, gas. These symptoms are usually brief and resolve once gas is released by belching or flatulence, rectal gas. Some people can be more sensitive to even normal amounts of gas and develop the above symptoms. But these signs and symptoms are often reduced with simple lifestyle changes. Excessive belching or flatus, accompanied by bloating, pain or swelling of the abdomen, distension, interfere with daily activities. Symptoms of bloating. Belching is a normal process and results from swallowed air accumulating in the stomach. The air can either be belched back or can be passed out of the stomach into the small intestine. It's subsequently passed as rectal gas, flatus. Bloating refers to a sense of fullness in the upper abdomen. This can be influenced by gas and/or food accumulation in the stomach. The gas is generally a combination of swallowed air and gas produced by the action of colon bacteria on undigested carbohydrates. Gas which accumulates in the right upper portion of the colon can lead to pain which could seem like gallbladder pain. Gas which accumulates in the left upper portion of the colon can radiate up to the chest and seem like cardiac pain. Possible causes of bloating. What causes bloating in the stomach? 1. Gas. Gas is a natural byproduct of digestion, but too much intestinal gas means your digestion has gone awry. You may ingest gases by swallowing air or drinking carbonated beverages. These gases mostly escape through belching before they reach your intestines. Gases in your intestines are mostly produced by gut bacteria digesting carbohydrates, in a process called fermentation. Fermentation rate may go up, if many carbohydrates weren't absorbed earlier in the digestive process. That could be for several reasons. Maybe you just ate too much too fast for proper digestion. Or you might have a specific food intolerance or gastrointestinal disease. Some possible causes include 2. Carbohydrate malabsorption. Many people have difficulties digesting particular carbohydrates, sugars. Carbohydrates give your body fuel it can use quickly. But too many at once can make you retain water. Simple carbs, white bread, candy, pastries, and soft drinks, enter your blood almost instantly. Complex carbs, whole grains, fruits, and vegetables, don't because they take longer to digest. Some common culprits include lactose, fructose and the carbs in wheat and beans. You may have intolerance, or you may just have difficulties that cause your body to struggle more with tougher carbs. Dairy products. Foods like milk and ice cream can cause gas, belly pain, and bloating if you can't easily digest a dairy sugar called lactose. It's not usually serious, but it's a good idea to avoid milk products. Some medicines can help you digest it more easily. This is not the same as an allergy to dairy, where your body's immune system treats it like a dangerous invader. That can be more serious, causing hives, vomiting, and bloody stools. Fructose. This is a kind of sugar, and it's harder for your body to break down than other kinds. They can lead to gas, bloating, and pain. It's in high fructose corn syrup, and in some fruits, especially dried fruit, as well as honey, onions, and garlic. A food diary can help you keep track of how you feel after you eat certain foods and figure out if this is a problem for you. A nutritionist or GI specialist can help you isolate your dietary sensitivities. 3. Small intestinal bacterial overgrowth, SIBO. This occurs when gut bacteria from the colon overflow into the small intestine. The overgrowth of these bacteria can also overwhelm other bacteria that are meant to balance them. Some bacteria actually absorb the gases produced by others. But too many of one kind and not enough of another kind can throw this balance off. 4. Functional digestive disorders. IBS and functional dyspepsia are diagnosed when your body struggles more with digestion for unexplained reasons. Symptoms often include gas and bloating after eating. Keep an eye out for classic alarm symptoms: diarrhea or constipation, nausea, vomiting, fever, bleeding, anemia, and unintentional weight loss. 5. Visceral hypersensitivity. Some people feel like they're gassy and bloated even when their volume of gas is normal. This condition often correlates with IBS and other disorders involving the gut-to-brain neural pathways. Some people even develop a muscular hyperreaction to make more room in the abdominal cavity for gas. It is called abdominophrenic dyssynergia. Their abdominal muscles relax and protrude outward in the presence of gas, even when the actual volume is normal. 6. Digestive contents. These can include solids, liquids, and gas. Digestive contents can build up in your digestive system when there is a backup or restriction in your digestive tract, or when the muscles that move digestive contents along are somehow impaired. Any buildup of digestive contents along the digestive tract will leave less room for normal amounts of gas to process through. It also leaves less room for other things in your abdomen, including circulatory fluids and fat. Intestinal buildup. Causes of buildup can include 7. Constipation. You may have occasional constipation due to diet or lifestyle factors. Or you may have chronic constipation due to an underlying condition. Backed up poop in your colon causes recently digested food to stay longer in the intestines, waiting to descend. Everything expands to contain the extra volume, leading to bloat. 8. Bowel obstructions. When it isn't backed up poop obstructing your bowels, it could be something more serious. Both your large and small bowels can become blocked by tumors, scar tissue, strictures, stenosis, or hernias. Inflammatory diseases such as Crohn's disease and diverticulosis can damage parts of your small bowels. They create strictures that narrow the passage of digestive contents. Motility disorders can cause constipation, or they can cause everything to move more slowly through the digestive tract. These are usually disorders of the muscles and nerves that sense digestive contents in the digestive tract. Examples include intestinal pseudo-obstruction, a condition that mimics the effects of an obstruction when there is none. Gastroparesis, partial paralysis of the stomach muscles, and pelvic floor dysfunction. 9. Recent weight gain. Weight gain within the last year or so tends to go to your belly first. If you've gained 10 pounds or more, it's probably impacting your abdominal volume. This means less room for normal digestive processes. Even a normal meal may cause you to feel abnormally bloated during digestion. Weight gain may involve water retention, which can make you feel bloated with fluids in your stomach and elsewhere. 10. Hormones. Your stomach bloating may follow a different cycle, not so much your digestive cycle, but your menstrual cycle. As many as 3 in 4 women say they experience abdominal bloating before and during their menstrual periods. Bloating is also a common complaint during the hormone fluctuations of perimenopause. Female hormones deserve a special mention when it comes to stomach bloating. They can affect bloating from many angles: fluids, gas, digestive backup, and also your sensitivity to those things. First, estrogen causes water retention. When estrogen spikes and progesterone drops, you'll notice bloating from fluids. This, in addition to the increased volume of your uterus just before menstruation, can give you a bloated stomach. But hormones also interact with your digestive system. Estrogen and progesterone can each cause intestinal gas by either slowing or speeding your motility. Estrogen receptors in your GI tract also affect your visceral sensitivity, what makes you feel bloated. Other causes. Bloating that comes and goes is usually digestive, hormonal, or both. These causes can also make you feel generally sick and tired. As long as your symptoms eventually go away, they probably aren't serious. But if your bloated stomach gets worse, or if you have other symptoms, you should seek medical attention. Other medical causes may include 11. Ascites. This is a gradual buildup of fluid in your abdominal cavity. It's usually caused by liver disease, and sometimes by kidney failure or heart failure. 12. Pancreatic insufficiency. This is a kind of pancreatic dysfunction in which your pancreas can no longer make enough digestive enzymes. 13. Inflammation of the stomach, gastritis, or the intestines, enteritis. This is usually caused by a bacterial infection, commonly, H. pylori infection, or by drinking too much alcohol. It can also be related to peptic ulcers. 14. Cancer, ovarian, uterine, colon, pancreatic, stomach or mesenteric. Yearly checkups with your primary care physician are important to screen for cancer. 15. Celiac disease and bloating. Celiac disease is a common digestive condition where your intestine cannot absorb gluten found in wheat, barley and rye. This is when your body responds to gluten, a protein in wheat, barley, rye, and many prepackaged foods, by attacking the lining of your intestine, a part of your digestive system. It can cause diarrhea, weight loss, pain in the belly area, and lots of gases, which can make you feel bloated. If you have celiac disease, eating foods containing gluten can also trigger diarrhea, abdominal pain and fatigue. There is no cure for celiac disease, but once the condition has been diagnosed, switching to a gluten-free diet should help. 16. Salt. Your body needs salt, but most of us get more than we need. It makes you hold on to, or retain, water and can cause more serious health problems like high blood pressure. And it's not just the salt shaker you should avoid. If you're like an American, most of your salt comes from prepackaged and fast foods. Check food labels for salt, sodium levels, and remember, just because you don't taste it, doesn't mean it's not there. 17. FODMAPs. These carbs are digested near the end of your intestine, where bacteria feed on them. FODMAPs or fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. They are short-chain carbohydrates that are poorly absorbed in the small intestine and are prone to absorb water and ferment in the colon. For some people, this can cause gas and fluid buildup, belly pain, and bloating. FODMAPs. FODMAPs are in some fruits, vegetables, whole grains, and dairy. Asparagus, garlic, pears, mangoes, peaches, wheat pasta, and rye bread are examples. Keep a food diary to keep track of foods that affect you, and ask a dietitian or doctor if FODMAPs might be to blame. 18. Soda. Those bubbles in soda and other drinks like beer, champagne, or seltzer are filled with gas. When you drink them, they can fill up your digestive system. You may burp some of it away, but once the gas reaches your intestines, it stays until you pass it. And most sodas are full of sugar, which can make you hold on to water and feel bloated. 19. Fat. Your body needs it to make cell walls, nerve tissue, like your brain, and hormones. But too much can make you bloated because your body takes longer to break it down than other types of food. That means it sticks around longer. It's also high in calories and can make you gain weight if you're not careful, and that can make you feel bloated, too. 20. Sugar alcohols are used to replace sugar in sugar-free foods and chewing gums. Common types include xylitol, sorbitol and mannitol. Sugar alcohols are also FODMAPs. They tend to cause digestive problems, since they reach the large intestine unchanged where the gut bacteria feed on them. Consuming high amounts of sugar alcohols may cause digestive issues, such as bloating, gas and diarrhea. What to eat instead? Erythritol is also a sugar alcohol, but it is easier on digestion than the ones mentioned above. Stevia is also a healthy alternative to sugar and sugar alcohols. Specific foods that may cause bloating include vegetables, broccoli, cauliflower, Brussels sprouts, and cabbage. Fruit, prunes, apples, pears, and peaches. Whole grains, wheat, oats, wheat germ, and wheat bran. Legumes, beans, lentils, peas, and baked beans. Sugar alcohols and artificial sweeteners, xylitol, sorbitol, and mannitol found in artificial sweeteners and sugar-free chewing gum. Drinks, soda and other carbonated beverages. While these foods may lead to increased gas, not everyone will feel bloated after eating them. Keeping a food diary may help you identify which foods cause your symptoms so that you don't have to follow an overly restrictive diet. Risk factors. Excessive air swallowing, and certain foods and carbonated beverages are significant contributors to belching and flatulence. Irritable bowel syndrome. Some patients with irritable bowel syndrome, IBS, appear to be uniquely sensitive to normal or even slightly increased volumes of intestinal gas and may develop abdominal cramps as a result. Some patients are with altered anatomy due to surgery or those with certain rheumatologic diseases. They may be at an increased risk of bacterial overgrowth in the small intestine, which can lead to belching, bloating or flatulence. Some patients, particularly women who have had one or more pregnancies, experience abdominal distension when standing erect. This is often assumed to be gas accumulation. If the distension is not present when the patient is lying flat, then the likely explanation is weak abdominal muscles. These muscles extend from the lower rib cage to the pelvis on both sides of the umbilicus. They become weaker due to the stretching and loss of muscle tone which occurs during pregnancy. Diagnosis: there are individuals who have heartburn and stomach disorders that may swallow air for relief. The diagnosis of esophageal reflux or gastric inflammation should be excluded by X-rays or endoscopy. It examines the esophagus and stomach with a flexible tube, while the patient is sedated. Abdominal distension when erect but not when recumbent is an indication of weak abdominal muscles. If lactose intolerance is suspected, milk can be withdrawn from the diet and symptoms observed. However, lactose can be administered orally and the hydrogen gas which is generated can be measured in the breath. Post-nasal discharge from sinus problems can cause air swallowing and should be considered. If bacterial overgrowth is suspected, your physician may administer a hydrogen breath test. Blood tests are not usually helpful for gaseous problems. But testing for celiac disease may prove useful since failure to absorb wheat, barley, and rye can lead to excess flatulence. Patients complaining of excessive gas passages may benefit from keeping a flatus diary for 3 days. The time of each gas passage and food for each meal can be noted. The gas passages can be compared to published normal flatus frequency. How to manage bloating. Patients should eliminate carbonated beverages such as soda and beer. Foods such as cauliflower, broccoli, cabbage, beans, and bran should be avoided. Milk and other dairy foods should be avoided. Lactated milk or non-dairy milk such as soy or almond milk can be used. Chewing gum and sucking on hard candies should be avoided. Sugar-free gum and hard candies should be avoided as they may have mannitol or sorbitol as sweeteners which can cause flatulence. Foods that cause bloating symptoms. To ensure that only potentially symptom-causing foods are eliminated without resulting in marked dietary restrictions. Patients should eliminate food items one by one and keep a symptom diary. Simethicone products have been promoted as treatment for gaseousness, but their efficacy has not been convincing. Charcoal tablets have also been used to reduce flatulence without convincing benefit. Bismuth subsalicylate has been used to reduce the noxious odor of some sulfur-containing rectal gases. Alpha-D-galactosides, an over-the-counter product, has been used to help in the digestion of complex carbohydrates. Individuals with IBS may benefit from symptomatic therapy for gas pains. By using antispasmodic therapies such as dicyclomine or hyoscyamine under the tongue. Some patients with bacterial overgrowth may see improvement from the occasional use of antibiotics. It may reduce the number of bacteria in the small bowel, thereby reducing gas production. For some, weak abdominal muscles are suspected as a cause for abdominal distension. For them, abdominal tensing exercises may be helpful, although difficult for middle-aged and older patients. If symptoms fail to respond to the dietary strategies noted above, medical help should be sought. To sum up intestinal gases and bloating, belching and flatulence are normal body processes. Swallowed air is gas in the body and contributes significantly to symptoms. Unabsorbed dietary carbohydrates can cause gas production by colon bacteria. Carbonated beverages, sucking on hard candy, and chewing gum should be avoided. Abdominal distension when erect but not recumbent may be due to weak abdominal muscles. Increasing frequency or severity of symptoms should prompt medical attention. Bloating and distension are the most common gastrointestinal complaints reported by patients with functional gut disorders. These two complaints are the most prevalent of the severe symptoms reported by patients with irritable bowel syndrome. Advances in the knowledge of underlying mechanisms, particularly with regard to the roles of diet, poorly absorbed fermentable carbohydrates, dysbiosis of the gut bacteria, alterations in visceral hypersensitivity, and abnormal viscerosomatic reflexes, have enabled the development of improved treatment options. The most significant recent advance has been a diet low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which significantly reduces patients' symptoms and improves quality of life.